Praise be to Allah, the cherisher and sustainer of the worlds. I'm Dr. Ramsha Mushtaq Khan, and today I have the opportunity to present on the topic the epidemiology of communicable disease with special reference to rubella under the kind supervision of Professor Dr. Saira Afzal. Quote of the day: everything begins with a thought, and thoughts are turned into plans, and plans into reality. Content outline: Introduction to rubella, dynamics of disease transmission, epidemiological determinants, clinical features and complications, prevention and control measures, milestones towards global rubella elimination, recent advances, and multiple choice questions. At the end of this presentation, the participants will be able to describe the epidemiological factors, prevention and control of rubella, and importance of rubella vaccine in disease elimination. Introduction. Rubella is a contagious viral infection best known by its distinctive red rash. It is also called as German measles or three-day measles. While this infection may cause mild symptoms or even no symptoms in most people, it can cause serious problems for unborn babies whose mothers become infected during pregnancy. The measles mumps rubella vaccine is highly effective in preventing rubella. In many countries, rubella infection is rare or even non existent. However, because the vaccine isn't used everywhere, the virus still causes serious problems for babies whose mothers are infected during pregnancy. World Health Organization facts: as of December 2021, 5 countries have been verified and have sustained measles elimination. For example, Bhutan, Korea, Maldives, Sri Lanka, Timor Leste. In addition, Maldives and Sri Lanka have sustained their rubella elimination status in 2021. Key facts: in 2020, 5 countries sustained measles elimination, 2 countries verified and sustained rubella elimination. 32.7 million children received MCVR in rubella 1. 29 million children received MCV 2. 32.3 million children receive RCV1, 50 million additional children vaccinated through mass campaigns, 4.3 million children with 0 dose of measles vaccine, and 3.6 million children with only 1 dose of measles vaccine. The epidemiological determinants: agent factors. The agent is the rubella virus, which is the RNA virus relating to the toga virus family. It has only one antigenic type. It is rapidly inactivated by chemical agents, low pH, and UV light. The reservoir is only humans. There is no carrier state. Source of infection is majority subclinical cases or even minor clinical cases. Infective material is the respiratory and throat secretions. Period of communicability is 1 week before and 1 week after the appearance of the rash. The signs and symptoms of rubella are often difficult to notice, especially in children. Signs and symptoms generally appear between 2 and 3 weeks after the exposure to the virus. They usually last about 1 to 5 days and may include fever of 102 Fahrenheit or lower, headache, stuffy and runny nose, inflamed and red eyes, enlarged tender lymph nodes at the base of the skull, the back of the neck, and behind the ears, a fine pink rash that begins on the face and quickly spreads to the trunk and then the arms and legs, therefore disappearing in the same sequence, aching joints, especially in young women. It can spread when an affected person coughs or sneezes. It can also spread by direct contact with an infected person's respiratory secretion, such as mucus. It can also be passed on from pregnant women to their unborn children via the bloodstream. A person who has been infected with the virus that causes rubella is contagious for 1 to 2 weeks before the onset of the rash until about 1 to 2 weeks after the rash disappears. In some parts of the world, the virus is still active. This is something to consider before going abroad, especially if you are pregnant. Rubella is a mild infection. Some women who have had rubella experience arthritis in the fingers, wrists, and knees, which generally lasts for about 1 month. However, if you are pregnant when you contract rubella, the consequences for the unborn child may be severe and in some cases fatal. Up to 80% of infants born to mothers who have rubella during the first 12 weeks of pregnancy develop congenital rubella syndrome. Congenital rubella. The rubella virus crosses placenta when the mother has acute infection. The earlier the fetus is infected, more serious disease is caused, and it may result in serious congenital abnormalities, including intrauterine growth retardation, hepatosplenomegaly, cataracts, mental retardation, sensory neural hearing loss, heart patent ductus arteriosus, pulmonary stenosis, and thrombocytopenic purpura. The classical triad of rubella constitutes PDA, cataracts, and deafness, and blueberry muffin rash. This syndrome can cause one or more problems, including growth delays, cataracts, deafness, congenital heart defects, defects in other organs, intellectual disabilities. The highest risk to the fetus is during the first trimester, but exposure later in the pregnancy is also dangerous. The rubella rash can look like many other viral rashes, so doctors usually confirm rubella with the help of laboratory tests. It can also be detected by a virus culture or a blood test, which can detect the presence of different types of rubella antibodies in the blood. These antibodies indicate that a recent infection or a past infection or a rubella vaccine has been carried out. For the purpose of laboratory diagnosis of acute infection is by the rising titers of antibody, mainly the IgG, and the presence of rubella-specific IgM. Immune status is screened by HIA, which is too insensitive for immune status screening, SRH, AIA, and latest agglutination, which are routinely used. 15 international unit per ml is regarded as the cutoff for immunity. No treatment will shorten the course of rubella infection. However, doctors often recommend isolation from others, especially in the case of pregnant women during the infectious period. If rubella is contracted while pregnancy, it should be discussed that the risk of the baby with congenital virus rubella syndrome is high. If the patient wishes to continue the pregnancy, they may be given antibodies called as the hyperimmune globulin, which can fight off the infection. In case of reduction of symptoms, it does not eliminate the possibility of the baby developing congenital rubella syndrome. The support of an infant born with congenital rubella syndrome varies depending on the extent of the infant's problems. Children who have multiple complications may require early treatment from a team of specialists. Simple self-care measures are required when a child or adult is infected with the virus that causes rubella, such as bed rest, acetaminophen for the relief of fever and aches. How can we prevent rubella from spreading? Maintaining high levels of rubella immunization in the community is critical to controlling the spread. Control of the spread of rubella is needed primarily to prevent the birth defects caused by the congenital rubella syndrome. Therefore, women of childbearing age should have their immunity checked and receive rubella vaccine if needed. Rubella vaccine. Rubella or German measles vaccine. CDC recommends children get 2 doses of MMR vaccine, starting with the first dose at 12 months through 15 months of age, and the second dose at 4 to 6 through 6 years of age. Teens and adults also should be up to date on their MMR vaccine. MMR is very safe and effective. One dose of the MMR vaccine. You do not need a vaccine if you had 2 doses of MMR vaccine after 12 months of age, have blood tests that indicate you are immune to measles, mumps, and rubella, and were born before 1957. Women born before 1957 do not need a vaccine if they already had a rubella vaccine or if they have a positive rubella immunity test. A vaccine is also not needed if the woman is pregnant. If the non-pregnant woman of childbearing age attend college, trade school, or post-secondary school, work in a hospital, a medical facility, childcare center, or school, and plan to travel overseas or take a cruise. Pregnant women or women who plan to get pregnant within the next 4 weeks, people who have had a life-threatening allergic reaction to gelatin, the antibiotic, neomycin, or a previous dose of MMR vaccine, if you have cancer or a blood disorder or another disease, or you take medication that affects the immune system, it should be consulted with a doctor before getting the MMR vaccine. If you have been exposed to the virus that causes rubella, you can keep the friends, family, and co-workers safe by telling them about the diagnosis. If the child has rubella, let the school and child care provider know about it. Vaccination drive in Pakistan. Pakistan has planned to add the combined measles rubella vaccine for children in its routine immunization schedule. The introduction is marked by a nationwide campaign starting in November 15 in the year 2021. Pakistan to immune more than 90 million children against measles and rubella. The nationwide campaign, which targets more than 90 million children aged 9 months to 15 years, is one of the largest in the world. Children up to 5 years will also receive polio drops. More than 386,000 health professionals, including 76,000 vaccinators and more than 1,043 thousand social mobilizers are mobilized for the 2-week vaccine campaign supported by Gavi, the Vaccine Alliance, UNICEF, WHO, and partners. The campaign targets children aged between 9 months and 15 years, and those aged up to 5 years will also receive the oral polio vaccine. Progress towards measles elimination. Measles and rubella elimination through a measles rubella vaccine targeting children aged less than 15 years. Now, MR vaccine is added in EPI schedule at 9 and 15 months of age. Suspected rubella case. Any patient in whom a healthcare provider suspects the possibility of rubella is known as a suspected rubella case. In such a case, a serum sample should be collected from the patient upon initial contact with the healthcare provider. This sample must be collected within 30 days of rash onset to be considered adequate. Laboratory confirmed case is a suspected rubella case that, after complete investigation, is confirmed as rubella using commercially available enzyme immunoassays for measles or for rubella IgM antibodies, and or confirmed by isolating rubella virus and or epidemiologically linked to another laboratory confirmed case. Clinically confirmed case is a suspected rubella case that is not completely investigated for any reason. This could include patients that died before the investigation was complete, patients lost to follow-up, or patients without adequate specimens submitted for laboratory analysis. Discarded a suspected rubella case that has been completely investigated, including an adequate blood specimen which lacks serological evidence of infection, has no virus isolated, and does not have epidemiological link to a laboratory confirmed case. If laboratory results indicate another viral infection compatible with the clinical symptoms, such as dengue, the case should be discarded. Vaccines given to a nursing mother do not affect the safety of breastfeeding for mothers or infants, and that breastfeeding is not a contraindication to MMR vaccine. Breastfed infants should be vaccinated according to the routine recommended schedules. If an infection does occur, it is well tolerated because the viruses are attenuated. Lack of exclusive breastfeeding until 5 months of age is a risk factor for an infant's poor response to measles vaccine. The Measles and Rubella Strategic Framework 2021 to 2030 envisions a world free from measles and rubella. The goal for the 2021 to 2030 period is to achieve and sustain the regional measles and rubella elimination goals. Measles and rubella are important contributors to childhood mortality and morbidity. Measles predisposes to other infections and contributes to malnutrition. Measles is a key marker of inequity and its control a marker of the strength of immunization systems. Measles vaccination accounts for 59 to 76% of the economic benefits from vaccination in the 94 low and middle income countries. The Measles and Rubella Strategic Framework 2021 to 2030 vision is the world free of measles and rubella, and the goal is to achieve and sustain the regional measles and rubella elimination goals. The strategic priorities include research and innovation, supply and sustainability, outbreaks and emergency, life course and integration, coverage and inequity, and commitment and demand. And the core principles include people-centered, country-owned, partnership-based, and data-guided. Measles and rubella vaccination is central to the Immunization Agenda 2030 by stimulating progress towards universal health coverage and equity in immunization. It could stimulate the establishment of life course vaccination through strengthening second year of life platforms for the delivery of the second dose of measles containing vaccine and school-based immunization delivery platforms for catch-up vaccination. A regional strategic plan for measles and rubella elimination in the World Health Organization Southeast Asia was adopted by 72nd session of the Regional Committee for the World Health Organization Southeast Asia region with the following strategic objectives. Number one is to achieve and maintain high population immunity with at least 95% vaccination coverage with 2 doses of vaccines and rubella containing vaccines in each district of each country, develop and sustain a sensitive and timely case-based surveillance system for measles and rubella, develop and maintain a proficient measles and rubella laboratory network. Strategic objective 4, which is ensuring adequate outbreak preparedness and respond rapidly to measles and rubella outbreaks, strengthen support and linkages to achieve the above strategic objectives. The 66th meeting of the Regional Committee for Southeast Asia in 2013 adopted the regional goals of measles elimination and rubella control by 2020. During the 72nd session of the Regional Committee for World Health Organization Southeast Asia region, the goals of measles elimination and rubella congenital rubella syndrome control by 2020 was revised to measles and rubella elimination by 2023. It is estimated that there has been 98% reduction in mortality due to measles in the region by 2020 compared to year 2000, and the estimated number of measles cases reduction by 82% for the same period. Impact of the COVID-19 pandemic, the decline in coverage of vaccination, the pandemic also delayed the implementation of mass vaccination campaigns for measles and rubella in Southeast Asian region and delayed various monitoring and evaluation activities. Number two, significant challenges to improve routine immunization to 95% or more coverage with 2 doses of measles rubella containing vaccine in all districts of all countries. Number three, sensitivity of the surveillance for measles and rubella remains suboptimal in endemic countries. Number four, an additional funding is required. Number five, ensuring optimal implementation of key elimination strategies as accelerated pace. Now it's time for the recent updates. Progress towards rubella and congenital rubella syndrome control and elimination worldwide, 2012 to 2020. The Measles and Rubella Strategic Framework 2021 to 2030 outlines potential actions to improve surveillance, including strengthening comprehensive surveillance supported by laboratory networks, promoting training of health workers in early detection, notification and investigation of cases using standardized definitions, tools, and templates for collecting data. Progress has also been reflected in the decline in reported rubella cases, including a 48% decrease during year 2012 to 2019, with a further decrease in 2020. Pakistan initiated the congenital rubella syndrome surveillance in 2018 at 4 sentinel sites and reported only laboratory confirmed cases in 2018 and in 2019. In the year 2020, however, Pakistan added an additional sentinel surveillance site and reported both 22 laboratory confirmed cases and 279 clinical confirmed cases for a total of 2,301 cases in year 2020. Rubella eradication not yet accomplished but entirely feasible. Rubella virus is the most teratogenic virus known to science and is capable of causing large epidemics. The RA27 by 3 rubella vaccine, usually combined with measles vaccine, has eliminated rubella and congenital rubella syndrome from much of the world, notably from the Western Hemisphere. The general use of MR or MMR combinations rather than measles vaccine alone should enable the elimination of rubella. Factors that make rubella eradication easier than measles eradication include good persistence of rubella antibodies. Now, coming to the multiple choice questions. Number one, when rubella infection occurs during pregnancy, serious consequences occur. Congenital rubella syndrome (CSR) is due to maternal infection with rubella virus. Which of the following statements is true regarding this syndrome? A description of 3 days of rash of German measles, the teratogenic lesions of cataract deafness and microcephaly in the fetus, combination of rash and post-infection encephalitis, side effects of MMR vaccine, and it affects only the mother and not the fetus.
B.
Yes, the answer is B. Rubella virus is spread via respiratory droplets through the air or close contact. Patients can transmit rubella during asymptomatic infection or from 7 days before the rash appears until 15 days after the onset of the rash. The time frame of greatest risk is from a few days before the rash appears to how many days after the onset of rash? A 5, B 7, C 9, D 11, and E 13.
B.
B7.
Yes, the answer is
B.
yes, the answer is B7. A 28 years old woman who is at 11 weeks gestation comes to the clinic for a physical examination and to receive appropriate vaccinations before beginning a job at a daycare center. The patient's medical and immunization records are unavailable. Which of the following is the most appropriate next step about administering these patients the measles, mumps, and rubella vaccine? A. Administered the vaccine at 20 weeks gestation. B. Administered the vaccine at 32 weeks gestation. C. Administered the vaccine at this visit. Administered the vaccine after the patient gives birth. And E. Recommend against receiving the vaccine.
D.
Yes, the answer is
D.
yes, the answer is D. In a recently conducted retrospective cross-sectional study carried out at a fertility clinic in Islamabad, 730 pregnant females who visited for antenatal checkups were analyzed, identified the most suitable method to find congenital rubella syndrome. A. Polymerase chain reaction. B. Complete blood count. C. Serum bilirubin test. D. Urine protein analysis. And E. Chest X-ray.
A. PCR.
Yes, the answer.
PCR.
Yes, the answer is A. Polymerase chain reaction. Between 25 to 50% of those who have rubella do not realize that they have it. This means that a person can meet rubella and become infected without realizing it. All of the following statements are true about congenital rubella except A. It is diagnosed when the infant has IgM antibodies at birth. B. It is diagnosed when IgG antibodies persist for more than 6 months. C. Most common congenital defects are deafness, cardiac malformations, and cataracts. D. Infection after 16 weeks of gestation results in major congenital defects. E. The rubella virus can cross the placenta and cause fetal infection.
D. D.
D.
Yes, the answer is D. The infection after 16 weeks of gestation results in major congenital defects because the major congenital defects come before this time. Number six, a male baby is born at 39 weeks gestation with a petechial rash, low birth weight, hepatosplenomegaly, and bilateral cataracts. This is thought to be due to an infection acquired while the baby was still in utero. Select the condition which is most likely to cause this clinical presentation. A. Cytomegalovirus. B. Group V. Streptococcus. C. Rubella virus. D. Toxoplasma gondii. And E. Treponema pallidum.
C. Rubella.
Yes, the answer is C. Rubella virus. MCQ number 7, 2,000 pregnant women attending the antenatal clinic of the Aga Khan University Hospital were tested. Susceptibility to infection decreased with age and parity, and greater attention should be paid to immunization of women of childbearing age. How does rubella cause fetal abnormalities? A. By crossing the placenta early in pregnancy and infecting the fetus. B. By only infecting the placenta. C. By inducing cytokines and chemokines in the mother. D. By raising the temperature of the mother and inducing an abnormal immune reaction in the fetus. And E. By causing direct damage to the mother's immune system.
A.
Yes, the answer.
A.
Yes, the answer is A. By crossing the placenta early in pregnancy and infecting the fetus. Number 8, rubella is a vaccine preventable disease. Multiple vaccination programs have led to a dramatic fall in the number of cases, and it has been declared eliminated from many regions of the world. Which of the following is a contraindication for the rubella vaccine? A. An allergy to eggs. B. Pregnancy. C. Receiving an immunoglobulin in the past 3 months. D. A documented history of the disease. And E. Personal history of febrile conversions.
Pregnancy.
Yes, the answer is B. Pregnancy. Most people who get rubella usually have a mild illness with symptoms that can include a low grade fever, sore throat, and a rash that starts on the face and spreads to the rest of the body. The age group most prone to the rubella virus is A. Children, B. Adolescent girls, C. Pregnant females, D. Women of childbearing age, and E. Elderly population.
A.
Yes, the answer is A. Children of 3 to 10 years. MCQ number 10, the rubella virus vaccine is used to help prevent this disease in adults and children who are at least 12 months old. All statements about the rubella vaccine are true except A. The vaccine prevents reinfection, thereby limiting the spread of the virulent virus. B. The immunogen in the vaccine kills the rubella virus. C. The vaccine induces antibodies that prevent the dissemination of the virus by neutralizing it during the viremic stage. D. The incidence of childhood rubella and congenital rubella syndrome has decreased significantly since the advent of the vaccine. And E. The vaccine is recommended for all children, adolescents, and non pregnant adults who have not been previously vaccinated or had rubella.
B.
Yes, the answer is B. The immunogen in the vaccine kills the rubella virus. Uh, this is the key of the MCQs. This is the link to our YouTube channel. Please like and subscribe, and thank you very much.
Thank you very much, Dr. Amsha. Very nice and informative presentation and very nice MCQs. I think in the last MCQ, Straxis is given on the correct answer. So this is very helpful for the students to know the right answer. And very well done, everyone. And thank you so much.
Thank you, ma'am. Thank you very much.
Thank you, ma'am.